Welcome to Stall Side Podcast.
How goes it today?
It's good. A lot of crazy in the world, but you know what? Focus on the good stuff and you do okay.
That's right. And everybody's crazy except you and me.
No, isn't that the
I'm starting to worry about you. I don't have my worries about me. So, yeah, we got a great guest on the show today.
Yeah, Dr. Etta Bradecamp, who's in our Theriogenology department, our reproduction specialist. She has been a rock here for quite a number of years and a fabulous person, just a real compassionate, level-headed, great person. I'm going to enjoy talking to her today.
Yeah. She came into the practice at a time when we needed a bit of help, and she stayed, and it's been great. And, yeah, she's good fun to get talking. And I'm looking forward to her insights on problem mares that don't get pregnant after repeated breedings. And she's also involved in dealing with the recipient herd as well. And just get a little bit of philosophy on that, because that's, it's a major part of the practice.
Yeah, you wouldn't think so being in central Kentucky, but we do have a large recipient herd and a lot of demand for it. So, but Etta's one of those, she's great to call on when you get in trouble with a broodmare. So looking forward to talking to her. Yeah,
it's going to be good. So on Stall Side today, we're talking to Dr. Etta Bradecamp from the Reproduction Service at Rood Riddle. See you soon. Dr. Bradecamp, welcome to Stall Side.
Hello, how are you today?
Oh, good.
Good.
Yeah, really
great.
Good.
Thanks for taking time out of your day to be with us.
No
Very
worries.
Much appreciate it.
I'm going to squeeze it in between a few mares, but we can get this done.
Yeah, absolutely. Yeah. So, Etta, tell us a bit about yourself.
Well, I wouldn't say I have anything to say extremely exciting about myself. I grew up in Virginia. I went to Auburn for vet school, practiced in Virginia for about 4 years before I did my equine practice residency. That was at LSU and also at a practice in Australia. Went back to Virginia and practiced for 4 years and came here in 2011. I was supposed to fill in for 5 months, and somehow I'm still here. So that's my story in a nutshell.
And we haven't got over the thrill of it. It's good. It's
yeah.
great to have you here.
Yep.
So
yeah,
lots of SEC schools that you threw out there. So you have deep roots in the SEC then.
Yeah, somehow. I learned that football is a religion when I went to Auburn and LSU.
Auburn, LSU, yes.
Yeah.
Yeah. Nothing else matters.
Yeah, we don't care as much about football in Kentucky, but basketball's a little bit different.
Yeah, I remember a time in Florida, it was amazing. About 3 o'clock in the afternoon on a Friday, all the RVs would start coming into town. There was nowhere to park.
There's nowhere to park.
Really?
It was just RVs everywhere. And then people would be sitting out there watching the game on their television because they didn't have tickets.
Yeah. No, they've got their whole spread out. They've got a big TV. And LSU, they would actually have ceiling fans hanging from their RVs, the canopies rolled out. I actually, when I was at Auburn, I went to go run at the track one day, and I forgot it was Thursday before a home game, and there was no place to park. And I said to my mom, there's no place to park. I said, but this is the only town you can park lawn chairs in, because they bring their big RVs. Mm-hmm. They park them on the sidewalks. They park them in people's yards, and then put lawn chairs in the parking spots, and it was all legal. I had cousins that lived and went to Auburn, and they came up to UVA for a game, and they said, golly, days are really strict up there. They just won't let you park anywhere. And I said, no. I said, they don't let you park on the sidewalk and people's lawns. It's crazy. It's a religion. And it's an atmosphere that's pretty
it's an aspiration
exciting.
to sort of watch the game in the same zip code as it's being played.
Yeah.
That is it. As long as you can do that, it's good.
Yeah.
So, Etta, what would you like to talk to us about today?
Well, I think we're getting to that time in the season. Since I do reproduction, we'll go down that road. But it's that time in the season where we're starting to see a few mares that have been bred a few times that haven't gotten pregnant. People start to get a little more anxious. I usually start to get the calls the end of April, beginning of May. And I think maybe that's a good topic, what we can do in those, when we only have a few cycles probably left in the season, to try to get those mares pregnant. And then if we get to the end of the season, they're not pregnant, what we can hopefully do to set them up for success the next year. So
that's great. So what do you do when just plain old biology is not working?
So the first thing I think we all should, I always say to do is go back to the basics. And when I look at a mare, I start at the rear end and just go forward. Does she have good perineal conformation? Does she not have a caslick and need one? Has she had enough foaling trauma at some point in time? She's lost her, like some of her natural seals that protect her from becoming infected and contaminating her reproductive tract, such as the vestibulovaginal fold. Is the cervix normal? Sometimes they had a fold this year and had some cervical trauma, and that can go undiagnosed or missed, So just start at the back, and then, has she had cultures done? Have they been positive? Have they been negative? What's been her problem? And you try to start to break it down into the very basics, and then that usually will lead you down one path or the other. I mean, if you tell me, well, she's been dirty every cycle, that's different than the mare that she's looked perfect every cycle and still isn't pregnant. And so that's where we start to try to dissect out those details and figure out what can we do for this mare that we haven't been doing, or do something different, or what is the problem that we can address. So, and each one of those might, like I said, have a different treatment, but that's where we start.
Yeah, so tell me about those mares that have been infected every cycle.
So those are the ones, we want to kind of make sure, are there barriers in place as far as do they have a caslexin if they need one? Do they have a vestibulovaginal fold that's incompetent? Some of these mares, you'll open them up and you'll hear them suck air and you can see all the way to the cervix. Well, that's a problem because she can't keep herself clean. The cervix, if the cervix is damaged, especially if it's on the ventral part of the cervix, and things that do manage to get into the vagina can kind of more easily run into the uterus. So she's constantly trying to keep herself clean because now the cervix doesn't act as one of those natural barriers. And then getting a culture on her. And some of those mares, if they've been chronically infected, it's not just that they have an infection, but they potentially have developed a biofilm or excessive mucus. And the problem with that is if they have a biofilm, which is a proteinaceous type of goo, I don't know a better word, but that the bacteria make that protects them from the mare's immunologic system and also protects them from if we just put antibiotics in the uterus. So then we have to say, okay, she's been chronically infected. Does she have an infection where she's got a biofilm and it's kind of sticking to the surface of the endometrium? And we actually need to break that down so that we can then get the uterus cleaned up. So those are some of the things we're looking at. And we can, if we have been growing the same bacteria or have been growing different bacteria, so we're trying to sort all those things out. What's the problem? And then some of those mares will use biofilm disruptors in, and we actually have a test where we can, in the lab, where we can tell what biofilm disruptors are effective against this bacteria. Because we talk about biofilm, but not all biofilms are the same, just like not all bacteria are the same. And there are some biofilms that are very resistant to a number of the biofilm disruptors that we use. So in a really chronically infected mare, sometimes that's the problem. We haven't used the right biofilm disruptor, the right mucolytic, the right antibiotic, because all this stuff is going on in the uterus. It's not just a simple dump some antibiotics in and you kill the bacteria.
Speaking about bacteria, what bacteria would you expect to see in a routine chronically infected mare versus like some particularly difficult infection to treat? How do you go through the process of diagnosing those bacteria, and what steps do you take to make sure we got the right treatments?
So probably the two most common bacteria we'll see across the board are either E. coli or beta strep. Some mares maybe more problems. Pseudomonas we'll see, Klebsiella, and then staph. Those are our 5 most common if you look in the literature. But I would say the top 2 would be the beta strep and the E. coli. And some mares, they'll be chronically infected with beta strep over and over again, and that can be just as bad as being infected with Pseudomonas. It's the first time it's come up, So once again, that's what we're trying to sort out. And if I see a mare, this time it's this organism, next time it's that organism, next time it's that almost to me kind of says, is she just chronically getting contaminated and she can't, deal with anything? If it's the same thing every single time, to me that sounds almost like a more deep-seated infection. Like it's been in there every single time and the treatments we are using are not effective.
Okay. What sort of, if you are going to treat the mare with antibacterials in the uterus, where do you start? Where do you go to? How do you make those choices? So
where I start, of course, first is with and let's say this is a chronically infected mare, so we'll kind of go down that path. First, I'll start with my culture and sensitivity. So that's immediately going to tell me at least what the organism is and what antibiotics it is sensitive to. And then from that list, there's only certain ones that we can use in the uterus. There's some that we wouldn't use and some we don't use. And then from there, I'm probably going to do a biofilm assay on that really chronically infected mare. That's not your normal mares that, you just, first time she's popped up a culture. But this is one that I've been called in to look at because people have been banging their heads against the wall trying to get her cleaned up. We'll run a biofilm assay, and the reason.
So can you just run us through that, exactly how you do that?
So from that same swab that I took a culture from the mare, we will submit that to the lab, and at the time we do that, we'll tell them, if she grows something, I'd like a biofilm assay. And kind of it's in the lab's hands at that point in time, but in a simple explanation, once they grow that bacteria on the plate, they've identified it, gotten their ID and sensitivity, they'll also then basically grow the bacteria, plate it into special wells that once it has grown and potentially formed a biofilm, which that's what we suspect. So if it forms a biofilm, then there's this assay where we then apply different biofilm disruptors to each one of those little wells to see if it'll break up the biofilm. And that's kind of how, I think, in a simplistic manner. I'm not a microbiologist,
sounds good.
But that's what it does. And then we can look and say, and the reason I say that's important is I had a mare a number of years ago. She'd been treated for a fungal infection for over a year, and by good veterinarians. And so she finally, when she came to me, I did the ID and sensitivity on the fungal agent, but also ran a biofilm assay. And it was not sensitive to any of the biofilm disruptors. So that immediately told me what the problem was. Nothing that we tried to treat it with was breaking up the biofilm. And DMSO is actually the most effective in actually killing the bacteria in the biofilm, even though it wouldn't break it up. So at least gave me a place to start with that mare. Because using some of the other things like hydrogen peroxide or something wouldn't touch the biofilm. So that's where we go in those.
So there's little protective domes. You just can't get to them.
Yeah. There's in this like proteinaceous goo, like I said, and they're just protected.
And that's relatively new techniques, is why I asked. I don't think that's commonly done.
In the last, I say 5 years, we really start to understand this. And we've learned it happens in human medicine and infections in humans, and we're just starting to understand. And I think something we always think of bacteria just being these little individual bacteria running around, but 90% of the time in nature they like to live in some type of biofilm, which makes sense because they're protected from the environment. So it's important to remember.
When you've chosen your antibacterials from your culture and sensitivity, what routes are you looking to treat that mare by?
So we'll treat them two ways. One is systemically, or one would be intrauterine, and secondly, systemically. And typically my approach is, and when I look at a mare that's chronically infected, and whether this thought is correct or not, when I think of any patient, whether it's humans or animals, when we have an infection, we usually like to treat them. Our doctors usually say take this antibiotic for 10 to 14 days, right? Well, when we usually treat the uterus, we have a 3 to 5 day window. And that usually works in a mare that just has a random infection that she's just, had bad luck and gotten infected. We can get her cleaned up in that period of time. Her immune system's effective. But when it's become chronic, I truly believe that in some of these mares, a 3 to 5 day infusion of an antibiotic just isn't long enough. It isn't effective enough to get what we need to potentially get rid of that bacteria. So what I'll do is I'll start with intrauterine fit therapy, and that'll give me that 3 to 5 day, whatever window the mare gives me to treat her. And then from there, I'll put her on a systemic antibiotic that the bacteria is sensitive to. I also worry in some of these mares, the infection's been going on so long, has it actually gotten down into the glands, so deeper within the endometrium, not just lying on the surface or floating around in the lumen of the uterus. So that's what I'll do. So, for example, I might treat her with, if it's sensitive to gentamicin, you could use that intrauterine and then go, systemically. If you have 3 to 5 days in the uterus, then you could maybe 5 days systemically. And sometimes what I use in the uterus might be different than what I give her systemically, because sometimes our choices of what we can give systemically might be different. But that's what I'll start. That's where I'll start.
You mentioned disrupting the biofilm so you can get at these bacteria, choosing antibacterial that's effective against these bacteria. Are there any non-antibacterial ways you can try to actually kill these bacteria? Are there things you can do to enhance your immune system? Because you've identified that as a problem.
So one thing we haven't mentioned that I think is our biggest tool in treating these mares is uterine lavage, because we can, I can dump a biofilm disruptor in there. But if I don't actually help that mare clean all that debris out, and I don't know if, I'm sure you all have seen in these mares, sometimes when you lavage them, the amount of debris that comes out of them. And so if we can break up some of that debris, whether it's the mucus, biofilm, and get it kind of stirred up in the uterus and then lavage them copiously, we can help them clear that out of there. So I think that's really important. And that's not an antibiotic at all. It's just, lactated ringer, saline, whatever we decide to use. So I think that's paramount to being effective in treating these mares. And I always start with breaking up, my mucolytics are another thing we talk about. Maybe there isn't a biofilm. I've seen mares that actually just have chronic inflammation. You cannot grow anything out of them. You can actually get a fair amount of debris out of them and still not grow anything out of that. But I think they've just been chronically inflamed and debris has just accumulated in the uterus. I mean, it's mucus and cellular debris. And you can lavage them and you'll see it floating around in the bag. So, and what also happens in those mares is that with chronic inflammation, the mucus, because the uterine lumen is a mucus producing, the uterine endometrium is a mucus producing epithelium that becomes very thick. Kind of like in the respiratory tract, you get chronic infection and your mucus, you get a cold or you just cough up that really thick mucus. Well, I think a similar thing happens in the uterus. The mucus gets thicker with chronic inflammation and they can't clear it. So then that's where we go to using mucolytics to just try to break that up. And some of those would be something such as acetylcysteine, hydrogen peroxide can be used, DMSO. So some of those. So those things aren't antibacterial, but some of those also will have antibacterial effects, even though they're not antibiotics. So I think it's kind of a combination, knowing what your organism is, and then targeting those treatments, uterine lavage, mucolytics, and some of the mucolytics are also biofilm disruptors, so they can play a dual role there if we just diagnose that the biofilm is also a problem. And then your antibiotics, I almost feel like is my last thing that I use once I've helped that mare break up the mucus, the biofilm, lavage it all out. Then I put my antibiotics in because now the antibiotics just have a small number of hopefully bacteria left that I've broken up and are floating around free and very susceptible to the antibiotic. So that's kind of my approach.
What about modulation of the immune system of the mare?
So there's been some good research in that. It's been a number of years ago where we can actually treat mares with immunomodulators. Oftentimes, one of the more common ones would be one that's a Mycobacterium cell wall extract. And it's been found that it will basically stimulate the immune system. And in some of these mares, that's what they need potentially to help them. And there's been good research to show that can improve pregnancy rates in some of these barren mares. But what's interesting is there's also research to show that treating them with steroids at the time of breeding can also be very beneficial. And I think, there's all kinds of different cytokines and inflammatory modulators, ones that actually ramp up and increase the inflammatory response, and others that modulate it. And I think sometimes we're trying to get that balance maybe back to where it should be. It's a little bit above my head, but one thing we know in mares, and a problem with these mares that have been bred over and over, when we get towards the end of the breeding season, we have learned from research that every cycle, that inflammatory response is a little bit more compounds. And I used to think, well, if I breed her this cycle, let's say she's dirty this cycle and I treat her, whatever, when I start over the next cycle, I'm starting over at ground zero. But that's not really true. If she's had a pretty profound inflammatory response, the next cycle, when she has that next inflammatory response, let's say she's clean and we breed her, it's going to be a more profound response than the one before. And then by the third cycle, it just compounds and it actually builds. So by the end of the season, we've got a fair amount of inflammation potentially going on in that uterus that we need to modulate. And I always tell people, and it's probably like my go-to phrase, we need to minimize and modulate inflammation in these mares to hopefully get that back under control. In addition, if they've got a chronic inflammation, getting that resolved. So,
what about the mares that don't have an infectious agent acting? You've talked a lot about inflammation.
Yeah, because I was going to ask that too, because those are the frustrating mares for me. The ones that you can identify a problem in, at least you got something you know how to work with. The ones that I always got the most frustrated with, so you got a young, healthy mare going to a fertile stallion, you're breeding her on time, she's just not getting pregnant.
Yeah, and those are, I think, the most frustrating because, like you said, you don't even have anything to grasp onto.
Yeah.
Because if she's a dirty culture, it's easy to explain to the farm, it's easy to understand, and then it's easy, we know things to treat that with. But when the cultures are over and over negative, you just start to scratch your head. But there are some things we know. There's a couple different things that go on in these mares also. So I'll go down one path. One, kind of the common scenario that when a veterinarian calls me, they'll say, I've bred this mare multiple times this season. Sometimes they'll say I bred her multiple times last season. For example, that maiden mare you breed her 3 or 4 times, and you get to the end of the season, she's never cultured dirty. She does everything right. She doesn't carry fluid. And sometimes we just chalk that up to bad luck, whatever, and we start the next season. And sometimes they'll even switch stallions. That seems to be something we'll try. Let's switch stallions. And then I'll get a call. We've bred her 2 times this year. We bred her 4 times last year, 2 different stallions. She always does everything right. And I think these are ones maybe 10 years ago we didn't really understand, but we've learned in the last 10 to 15 years that some of these mares will develop plugged oviducts. And that's a hard thing to diagnose because there's nothing we can do. We can't see it on ultrasound. There's no imaging that we can say, look, there's a plug right here and here, and I know our oviducts are blocked. It's a diagnosis we come to by exclusion of everything else. So there's that mare that's standing in front of you, and over again, everything has been just fine. And this can happen in 4-year-old, 5-year-old maiden mares, an 8-year-old mare that's had 4 foals in a row. It doesn't seem to, and it seems to be something that will just happen like one time to a mare. She doesn't usually become a repeat offender. But thankfully, in the last 10 years, we've come up with a number of different ways to treat these mares. And oftentimes, most of the time, they're very rewarding to treat. You treat the oviducts, and there are a number of different ways we can do that. We can go in laparoscopically and apply PGE2 to the oviducts. We can go in hysteroscopically and actually mechanically flush the oviducts by catheterizing them. And more recently, we even apply PGE1, misoprostol, to the oviductal papilla, just deep horn. But all of these have shown through nice studies, obviously just clinical studies, not controlled, blinded studies, but that these mares that we have tried over and over again, we can treat the oviducts, and usually in 1 to 2 cycles they'll be pregnant. So that's one. The mare's nothing, she doesn't have an infection or anything. And sometimes we spend a lot of time treating the uterus, and that's not where the problem is at all. And then there's some mares, we talked about the ones just chronic inflammation. Every once in a while one of those comes along, no infectious agent. And I think those are the ones where, and Dr. LeBlanc, remember a long time ago, in these barren mares did a nice study with the treating them with acetylcysteine and how that can improve pregnancy rates in some of those mares. And I think some of those, it comes back to minimizing and modulating that inflammatory response. And sometimes they maybe have gone to a subfertile stallion, so it's not the mare's fault that she's not pregnant, but now we're 3 and 4 cycles down the road, and she's gotten a little more inflamed each time and hasn't been able to really deal with it as well. So that's another case. And then, sometimes it's just something, I've seen mares that have retained endometrial cups, some of them from 1 or 2 years ago, like the last time they were pregnant. We had one recently that was presented to us as a maiden mare, and a maiden mare, quote unquote, and she was 5 years old, but kind of with her, she wouldn't quite cycle normally. Like you'd come back to short cycle her and she'd have an extra CL that she didn't have before. Come to find out she'd lost a pregnancy 2 years ago that everyone had forgotten about, like lost it by 60 days. And then she had very low ECG levels. And some of those can be troubling because they'll do almost everything right for you, but something's not, they'll maybe ovulate a little bit sooner than you thought. Check their ECG levels, they're 2 or 3, and you start to put the whole puzzle together. Every once in a while I'll see an extra CL that wasn't there. She ovulated a little sooner than I expected her to, but the next cycle I caught her. So sometimes it's just kind of bizarre things. So
one thing you mentioned earlier was one thing people always try is switching stallions. Is that important? Is that, wives' tale, or is there something to that?
I don't think there's any data or literature. Wouldn't that be nice to actually, have a study to see? But it seems like it works often enough that we keep buying into it. When wouldn't you say, like, you're like, okay, let's just switch stallions, and whether the stallion was maybe a little overbooked and maybe this mare had bad luck the day she got bred, or you just, timing, who knows, and then you switch stallions and all of a sudden she's pregnant. Now, I can tell you, in some situations, it is a semen issue. I mean, I can tell you a mare that I've probably bred 8 or 9 times to a stallion. He's unfortunately deceased, so we have frozen semen, cannot get her pregnant. And as soon as I switch and breed her with cooled ship to a different stallion, she's pregnant. So I know it's not the mare, I mean, as soon as if it is, it's a mare stallion component, because as soon as I switch stallions, so there is something to that, But sometimes it's semen quality, depending on if it's live cover or cooled shipped or frozen. So, and then sometimes I think we focus so much on the mare, we forget the stallion component, and then you get to the end of the breeding season. How many times this happened? And then you start to, either you've bred enough mares to the stallion, you kind of start to look at his numbers and go, oh, well, he wasn't getting a 60% per cycle conception rate. He was getting about a 35%. Well, right there, more mares are going to end up open at the end of the season. So got to remember that side of the equation too. So.
No, I've found the same type of thing where you breed them all year the same stallion, then you switch and do nothing different, but that works. And the ones I've seen that I can put a little bit more correlation into is the early embryonic loss and changing stallions. It seems like, you have those mares bred to one stallion for a couple of years in a row and they keep losing pregnancy after pregnancy, switch stallions and they start having foals again. Yeah.
The hard part of the mares that have the early embryonic loss, some of those young mares, and you switch stallions and they still do it. Those are the ones, and there's, you see one every year or so, that, I was just talking to another theriogenologist out in Oklahoma, and it's her own mare, and repeatedly the mare will lose her pregnancy, and she's done tried different stallions. So we don't have this option in the thoroughbred industry, but in other breeds, we can do embryo transfer. And then you just take the embryo out of that uterus and put it in a different uterus. So is it a mare? And I sometimes wonder, is there an immunologic component going on to those? Some of those mares, I'll try to put them on low doses of dexamethasone and see if I can get them past that point where they lost them. And we've all tried that, aspirin, all those different things to try to modulate the immune system. Is there something I can do to get her past that point where she loses it?
No, I think the point is there's tons of room for research still out there. Lots to learn yet.
Oh, lots to learn. The more we learn, the less we know. And it feels like every time you turn over a rock, you're like, oh, geez, I didn't know this was there.
That's why I like when biology just works the way it's supposed to.
It just does what it wants to do. So hold my beer, I'll show you how to do it.
Yeah, let me show you. Just when you think you're getting good at it, you're like,
But that's a good point, that the uterus likes being pregnant, but it's not necessarily that welcoming to the conceptus sometimes, because conceptus is genetically foreign.
Yeah.
And so there is this massive machinery in that uterus to kick out anything that's foreign, and you have to rely on everything going right for that little conceptus to say, hold it a second, don't show me the door because I'm supposed to be here. And there's so many little things that can go wrong that, to your point, we imperfectly understand.
Yeah.
Is that we sort of think we know how this pregnancy is signaled, but then we've got all of this ornate immune system that has to be down-regulated, and other parts of it have to be regulated up, like the T regulatory cells, to actually sort of say, no, leave this conceptus here to grow. It wants a nice little fluffy foal in 340 days. Don't kick me out. Yeah. There could be something wrong in that for those mares that just repeatedly conceive and repeatedly lose. It may just be that, some part of the hormone cascade goes wrong.
Yeah.
Some part of the cup development doesn't go right. Some part of the immune system says, nah, I'm not going to turn off.
Yeah.
And how do you fix that?
We got a real tough mare pregnant one time, and we were high-fiving each other, and the guy who owns the farm came along, and he said, you can high-five yourself all you want, but you're only on the 5-yard line. You got 95 yards to go.
Yeah.
And he went through foaling was only the 50.
Yeah.
And I think like the 40 was OCDs. And anyway, he just listed all the things.
I always say, let's not cheer about this until they're sold. And when they're gone, we got them through the sale, wherever they're going. Yes, we did it.
Touchdown.
Yeah, touchdown. Yeah. Spike the ball.
Yeah. When's the mare going to foal? When the foal's on the ground. Yeah. It's that sort of thing. Yeah. So you also involved in another aspect of the practice, the recipient herd. So tell me a little bit about putting that herd together. What are the qualifications for mares to come into that herd, and what are the expectations of those mares?
So we'll start with the qualifications. And the most important thing is that we have young, reproductively sound mares that will be able to carry a fetus to term and deliver a live foal, healthy foal, and then be able to raise it. So that's everything from the mare's disposition, so that, people can handle the mare. And then when she has a foal, she does a good job as a mother taking care of the foal. We also, size plays a role to some degree, because we see everything from very small quarter horse mares, like reining type mares, all the way up to, 17 hand mares, big, jumpers and warm bloods. And so overall, the mare's uterus is pretty amazing that you can put embryos in from different size donor mares into recipient mares. And those foals, as long as the disparity isn't great, as long as you don't stick a draft horse and a pony or a pony and a draft horse, those foals will reach their genetic potential. So that's the beauty of that. But still, owners, if you have a 17-hand, warm blood mare, you don't want us to send you home a 14-hand quarter horse mare. And also, if it's going to be a quarter horse baby, it doesn't need a draft mare that gives milk for a draft foal. So that's kind of the simple part of it. And then, like I said, young, reproductively sound, because what we want is to maximize our chances that embryo takes and that she's going to carry it to term. So our mares, they come into the herd when they're about 3 years of age, and they'll usually start to attrition out of the herd, when they're somewhere a little bit over 10 years of age. But there's no absolute, because we know some mares are incredibly fertile, and I have some mares that are 13 or 14 in the herd. But that's because every time I put an embryo in them, they immediately get pregnant and they go raise a foal, So why would I get rid of her if she's still doing a good job? Once they get over 10 years of age, we do uterine biopsies every year to make sure if she's staying in the herd, she warrants staying there. So they start to attrition out once they're about 10 or 11 years of age. And those are the most important things. And the thing you will see when you see recipient mares, it doesn't matter what they look like. They come in all different breeds and colors, and some of them are not the most, to some people, most aesthetically pleasing or beautiful horses, but I always say it's what's on the inside.
Yeah, that's right. True beauty's on the inside.
Yeah, as long as
I've said that before, haven't I?
Yeah, the beauty. So as long as you can take care of that foal and raise it, they, all of them are reproductively evaluated, from everything from perineal conformation to, making sure every time they come back from having a foal, they haven't sustained trauma to their cervix or the vestibulovaginal fold, making sure that their culture and cytologies are clean. And they also go through a very stringent biosecurity quarantine period when they come into the herd to make sure that we've done everything in our that's possible to screen them for infectious diseases, so that when they leave our herd and go to someone's home, that we know that they are sound in all ways, the best that we can.
Yeah, and I think it's probably not really appreciated by people is how difficult it is to get the mares that meet all of those criteria. Like, you just can't sort of get on your computer, dial up, I have a box of mares from Amazon to act as recipients.
Yeah, no,
right? It would be good if we could, wouldn't it? Right? But
Etta would appreciate it.
Yeah, it would be easy, but you can't do it.
Yeah, and there's times where as much as I'd love to use thoroughbred mares, they don't do as well in a herd as maybe a quarter horse or a Tennessee walk-in horse. Their longevity is going to be less. I think their longevity as far as their reproductive soundness sometimes doesn't go, quite as long. And they also do not hold up. They have to be able to live in big herds and fight a little bit for their position in that herd. And thoroughbreds, for some reason, don't do that as well. If they're in a group of thoroughbreds, they seem to do better. But I don't know if some of the other breeds are just, I'm being facetious, or meaner or whatever, but they're just, they're the ones that are more likely, they're going to have feet problems more so than your walking horses and quarter horses, more likely to get things like rain rot and not maintain their weight in the winter time and have abscesses in their feet. So as much as, there's a lot of thoroughbred mares that don't make it in their first career, that'd be great to use. I mean, we do have a fair number now in our herd, but even just simple things like that. I always say the walking horses out of the hills of Kentucky are some of the best, but you also think if they're here, it's because their parents were probably quite fertile, because there probably wasn't much human intervention to get them here. They come from, backyards and things like that. So they're incredibly, Tennessee walking horse mares are incredibly tough mares and good mamas. And so we have a lot of those in the herd. They're not the prettiest, but some of them, but.
I think you pick up on a good point there, is the maternal ability of that mare, in that she has to produce good milk and has to make it available to the foal.
Yeah.
So that the temperament thing is hard to predict how she's going to be after she foals, and everybody wants that mare to take that foal. I mean, we all want that, but sometimes we get them in the hospital. These mares do not want that foal, and nobody can predict that.
And that's the hard thing. You know, I wish every mare in the herd had already had one foal, but, you know, when we want to get them when they're young, there's going to be always the first foal. And as much as in a perfect world, I would never send someone a maiden mare because then I can't tell them how good of a mom she's going to be. But unfortunately, a lot of those young maiden mares, the pregnancy rates are much higher. Mm-hmm. And most of them are going to do a great job, you know. There's going to be the occasional one that it just doesn't suit her motherhood. Mm-hmm. There's no way to, I have not learned how to screen for that.
No,
you know.
possible.
Now, if she's crazy, then she'll get culled out of the herd because we can't catch her, or, you know, she's just absolutely nuts. And what's really interesting that I never knew this before I started working a lot with large groups of brood mares, but how they act in the herd is completely different than when we send them home. And sometimes we will get mares, they can have lovely dispositions and easy to handle. And then when they get integrated into the herd and they live in that herd for months on end, some of them go rogue. I mean, it's like a teenage girl that has decided, you know, she's raised in a good Christian home or whatever, and, you know, her dad's a pastor, and she's all.
You're starting to worry Bart right now.
Well, I was sitting here wondering, going, are we still talking about horses, or are we talking about?
But they do, and when I was working with one yesterday, and they said when she came, she was so nice, and now catching her, she's not as easy to catch, and then sometimes we'll have ones that we really don't like in the herd. I mean, they're good moms, but they're the more difficult ones. Not that we would call them for it, but they're not our favorites. And we send them home, and the people love them. But they get them home. They treat them as an individual. Sometimes they get them home and turn them out in the back 40 for 3 months, and then they can't catch them. And we're like, you know, when we were handling them every day, because we handle them every day. You know, they're being caught and checked and everything. So it's amazing how their personalities change. And sometimes if they pair up with a certain mare, they'll be awful. You switch them into another group.
It's like that friend that just. My guess is they're about 14 or 15 years old when they do that, because that's about what happened to my daughters. They, you know.
Yeah, you're just like
they were sweet in the house, and then they got that friend, and
and you're like, what has happened to you? You know. But it's so funny because we'll tell people, oh, this is a lovely mare, and they'll call and say, oh, she's horrible. We can't do this or that. We're like, are you talking about the same horse, you know? And I used to think, oh, well, obviously we didn't, but it happens often enough, you know? And just the exact opposite. We had one that was horrible. The lady, I mean, she wasn't horrible, but she was the kind of mare that in a group was very aggressive as far as you go out and feed and stuff. And you just thought, oh. And the lady took her home and loved her. And we even said, just watch her. She can be around feeding time. She's more aggressive type mare. The lady loved her.
Yeah.
Great.
That's
so there. As much as we try to, and we work really hard. I mean, different herds are managed differently. A lot of them are ran up like cows and not led, but ours get led every time they come up. They have to be halter broke and able to be led, and they get their feet done every 8 weeks. So there's a lot that goes into it that you don't even think about.
Yeah. Well, the important thing is people need to realize that everybody's in good faith trying to provide the best mare possible. It's not just a uterus. You're trying to send home a package.
Yeah, the whole deal. Because I don't want to hear from you. I want you to call, and I love it when I get these great pictures of our recipient mares with their newborn foals, and when they come back, because we have a little form, you know, or a quick questionnaire for the people. How was she, you know? And we like when they say, oh, she's a great mama, you know? And so it's like, great, she's going to stay, you know? So yeah, there's a lot there. It's
keeps it interesting.
Yeah. Oh, it does.
Yeah. So what does the future hold for Etta?
What does a future hold for Etta? Well, right now, it's about 3 months of a lot of mares to palpate and a lot of problems to solve when people like Bart call me and say, I can't get this mare pregnant. What's wrong with her, you know? So then I get to pull my hair out, and Bart says, she's off my list for a while. So
I usually say, what's wrong with me, not the mares. That's what I first.
Well, yeah, and you're like, why isn't she pregnant? What did I do wrong?
Yeah, exactly.
Yeah, I don't know. I find it's funny when I hear other people say that, because I feel like I'm the only person. I check the mirror and she's not pregnant. I immediately have that sinking feeling, and I'm like, she's not pregnant. I failed. And I'm thinking, well, I don't know that I failed. I mean, she got to the stallion on time. She ovulated. Everything looked great, but I blame myself before I blame the stallion or the mare.
Yeah,
so.
there you go.
And Mother Nature pulls the top off another bear and chalks one up.
Yeah,
that's right.
Yeah, great. Okay, well. it's been a good tour through the mind of Etta Bradecamp.
Yeah, it might be a little scary, but
yeah, no, I mean you do important work, and it's great to have you on the team. And this town runs on broodmares.
That's right.
So, yeah.
No, it's great, and appreciate you spending time with us today. No, it's busy, and very grateful for you being here.
No, thank you guys. Hopefully, this is helpful for someone out there. You know?
Oh yeah,
yeah, it will be.
It's been a good session. So, we've been talking to Dr. Etta Bradecamp from the Reproductive Service at Rood Riddle. See you next time.